So thanks, Devin, for that comprehensive discussion of the history and some of the mechanisms of psychedelic medications. I wonder if you can just remove that. Thank you. I'm not going to, therefore, spend much time on the science of it. And let's face it, the science is still evolving. It's very early days. And well, to me, the science is always interesting. I don't hate to be at all. I'm going to be a heretic about it and say I don't care. And it's not that I don't care because it doesn't matter, but it's kind of like gravity. I mean, you don't have to understand gravity to believe in it, just because it works, How does it work? Because if I walk, I'm not going to float to the ceiling. It's because of gravity. Now, do I have to understand the mechanics of gravity? Not necessarily. There is the Western mindset that says that everything needs to be researched and everything has to be proven and all the I's have to be dotted and the T's crossed before we can go ahead and work with something. And that may make sense in the realm of Western medications, where pharmaceutical companies are forever concocting new compounds with a view of making profits. And it's good that we should demand some proof that they're actually effective. But in the case of the psychedelics, and especially the plant medicines, as Devin said, they've been used for thousands of years, it's kind of Western arrogance to dismiss the experience of indigenous peoples whose practices have clearly shown the benefits. And we just need to listen to them. And to go in there and have to prove to ourselves all over again what they already know is just our particular form of superiority complex. Or maybe our particular fear of not trusting something unless our intellectual minds can provide some verification. Now, I myself came across that mentality when some years ago, when Health Canada actually inaccurately had the impression that I was doing clinical studies with ayahuasca, and they sent me a note saying that if you continue to do that, we'll have to call the RCMP because it's an illegal substance. By the way, Health Canada acknowledges that ayahuasca is neither addictive nor harmful, so you tell me why it's illegal. But nevertheless, then I phoned them and I said, okay, great, clinical studies, what I got to do? So they told me, here are the rules, and I figured out that if I had $10 million and an infinite amount of time, I could actually do clinical studies with ayahuasca. I could do that, or I could just keep working with it because it works. I chose to keep working with it because it works. So I don't need double-blind studies to tell me that something works when I know that it works. And the whole idea of subjecting particularly psychedelics to double-blind studies is rather naive, because double-blind implies that neither the provider nor the client knows if they're receiving a placebo or an active substance. Well, how the heck do you give somebody ayahuasca and not have them know that they've taken ayahuasca? How do you give them a placebo and not know that they haven't taken a placebo? Not to mention also, as Devin says, in the psychedelic work, as important as the substances is the set and the setting, the mindset of the individual, the intention going into it, and also the support and guidance and therapeutic caring of whoever is conducting the event. Now, how do you do double-blind studies on compassion and caring and insight? And say in the ayahuasca ceremonies, in the traditional Peruvian or Amazonian modalities, there's a lot of music and chanting. So what do? You bring in the wrong music, and that's the placebo, and some people get the right chanting. And so it's actually So studying this stuff in the Western modality is actually beyond rationality. Now, honest to God, 10 years ago, if you had said to me that I would be giving a talk on psychedelics and healing, what are you talking about? It just wasn't part of my education or my experience. And I would have been rather suspicious. And it was only 8 years ago that a lot of people kept asking me what I knew about, say, ayahuasca and the healing of addiction. And I kept saying, I know nothing. Why don't you ask me something that I do know about? But the question kept arising and arising, and finally I figured out that maybe the universe is trying to tell me something. And so I did have the opportunity to participate in an ayahuasca ceremony, and I got right away why people have been asking me. And since then, I've had experience taking and also working with MDMA, LSD, psilocybin, and of course, for me, most frequently, ayahuasca. And I've seen amazing results. And I'm not saying it's some kind of a panacea. It's not for everybody. Nothing is for everybody. And there's all kinds of issues in how it's best done. But the results have been spectacular, some of the ones that I've seen. And although this talk was geared to focus mostly on addictions, and I've seen, well, here's a letter I got from somebody just a couple of weeks ago. This is from a guy called, I won't give his name. This is somebody who came to one of our retreats, and he writes just before Christmas, I just wanted to express my deep gratitude yet one more time for the introduction to the healing that not just saved my life after a very difficult life with complex trauma, addictions, and suicidal depression. A bit after 3 years of our retreat, I find myself still doing the work, working with plants, meditating and practicing yoga daily, doing somatic and psychodynamic psychotherapies. I've been paying my rent monthly, have kept a job I love for 2 years, and I'm in a real and fulfilling relationship with an incredible guy for 3 months. I've been working on developing healthy sexuality instead of quitting my sex addiction. So in other words, rather than seeing his former sex addiction as the problem, he's actually now just exploring his healthy sexuality. And I've lost 125 pounds and been over 3 years without contacting anyone in my destructive, abusive family. I'm planning to go back to university to do a master's and PhD in psychology and sexuality, and so on. Feels great to live without compulsions. It just gets better. And I could cite you dozens of such letters. A woman in Toronto who tried to kill herself 17 times, literally, is now studying to be a therapist. I can tell you the story of a woman with a fatal autoimmune disorder. Her name, I'll call her Wendy. She lives in Boston. And I could find some of her writing on my computer here, but she's a very eloquent writer, and she talks about, she had this condition called scleroderma, which means hardening of the skin, hardening of the soft tissues, basically means a rigidification of everything, so that instead of being able to type, she could not even touch the keyboard anymore. She couldn't get out of bed without assistance, couldn't move around without a wheelchair. And all the Western treatments that sometimes at least can slow down the process, which can be fatal, had failed in her case. And she literally wanted assisted suicide. And then she drank ayahuasca one night, and she got out of bed all by herself. And now she's walking around freely. She sold her wheelchair. The wheelchair doesn't need it anymore. And she's writing her autobiography. And so the question is, well, how would a substance that you ingest then cure a disease, or cure addiction, or help turn around deeply entrenched depression? Well, there's no answer if you look at it on a level of pharmacology. See, Western medicines, Western pharmaceutical interventions, amazing as they can be, they do something very specific. They kill a bacterium, or they suppress the activity of the HIV virus, or they suppress the immune system so it's not so active attacking yourself, or they suppress inflammation or something. And we can more or less know the cellular mechanisms by which they do that. But what is the cellular mechanism for getting out of bed after having drunk ayahuasca? What is the cellular mechanism for the transformation of a depressed mind into a mind with possibilities? Why does somebody give up cigarettes or alcohol or cocaine or sex addiction after a set of ayahuasca experiences? Or MDMA, how does that act on turning around profoundly destructive state such as post-traumatic stress disorder? You cannot understand that on the biochemical level. I mean, it'll have its biochemical activities and correlates, but you can't understand on that level. You can understand it only if you understand what disease and addictions and mental illness are all about. Most diseases, addictions and mental illnesses, what are they about? And they're about, in my view, and in a view of a lot of evidence I could cite, what Devin talked about, which is traumatic experiences in life that ingrain in people a certain way of seeing themselves, certain ways of behaving, that are actually adaptive to the situation, but then they become sources of problems later on. And I'll quote you here from an article from the journal Pediatrics, which is the official journal of the American Academy of Pediatrics. And this article was published just 4 years ago. And it was called An Integrated Scientific Framework for Child Survival and Early Childhood Development. So this article is from the Harvard Center on the Developing Child. And they say, growing scientific evidence demonstrates that the social and physical environments that threaten human development because of scarcity, stress, or instability can lead to short-term physiologic and psychological adjustments that are necessary for immediate survival and adaptation, but which may come at a significant cost to long-term outcomes in learning, behavior, health, and longevity. In other words, the ways that people adapt to early stress, be it overt trauma like abuse, sexual or physical emotional abuse, or neglect, or more subtle forms of trauma, such as simply parents who are too stressed to fully respond to the child. These losses, these stresses, entrain certain adaptive behaviors that help the child endure the immediate difficulty, but the problem is that once they become ingrained in the body and the brain and the personality and the psyche, now they create problems. So I mean, the clear example I can give you is my own ADHD, the absent-mindedness, of ADD, the tuning out, which is clearly an adaptive mechanism in situations of stress. When you can't do anything about the source of the stress, you can't escape it, and there's no help available, your mind just tunes out. That's an adaptive thing to do. But if that goes on over time, and especially it happens at a time when the brain itself is developing, then what is meant to be a temporary state becomes a long-term trait. And it's helpful as a temporary state, but of course, it creates a problem later on. And and I'll tell you one more thing here, quoting from this article on brain development itself. It says that the interactions of genes and experiences literally shapes the circuitry of the developing brain. So the brain develops in interaction with the environment. It's not genetically programmed, purely. And it's critically influenced by the mutual responsiveness of adult-child relationships, particularly in the early childhood years. In other words, that the circuitry of the brain for its healthy development depends upon healthy interactions with responsive adults. So it doesn't take overt trauma in the sense of terrible things happening. It's enough for children just not to get that responsiveness for their brains to be affected in negative ways, and then for them to adapt ways of behaving that are meant to compensate for the loss of that connection with the parent. So in the case of the woman with scleroderma, which again, in the classical medical perspective, we don't understand what causes it. Why does the immune system turn against the body? And what, you'll never find a case of scleroderma that there wasn't childhood trauma. You just will not. And in the case of this particular woman, who I called Wendy, it was that she was an adopted child. She was a Korean orphan, went to several care homes by the time she was 1 year old, at which point she's adopted by an American evangelical couple, brought to the US. So serial abandonment in the first year of life. Coming to the US, where the mother has a nervous breakdown when she's very small, and the father, in a moment of religious remorse, when she was 16 or 17, confesses to her that he sexually abused her from age 2 onwards, for years, which memory she totally repressed. Now, how does somebody adapt to that? Well, one way of adapting is, first of all, early trauma sets off inflammation in the body. We can measure inflammatory chemicals in the adult that bespeak early trauma. And secondly, so then in other words, there's a risk for heart disease, cancer, and autoimmune disease. And secondly, though, there's certain behavior patterns that continue to generate stress. And in Mandy's case, it's to be very nice to everybody, not to express her anger. I mean, when she's being sexually abused by her father, it would have cost her tremendous grief to express her natural anger and the fight back mechanism. She has to suppress that. She literally has to become emotionally rigid in order to survive. And then, of course, she becomes the people pleaser who takes on everybody else's problems and stresses herself. And then the emotional rigidity then shows up in the physical rigidity of her body. So the healing takes place not because the ayahuasca somehow miraculously interferes with the disease process, but because Mandy, I just gave her a real name, because that's okay, she lives in Boston and she's going to write a book, so it's okay. I'm actually advertising for her. What she did during the plant experience is she reconnected with a part of herself that she had to suppress as a child, which is the part of herself that cared about herself, that valued herself. And this shows up for her in the form of entities that talk to her. And they say, we'll take care of you. And that's what happened on that first night. Now, I've never had entities talk to me, and all the times that I've done any psychedelics, so I mean, they don't like me, I guess, I don't know what it is, but they just don't come and talk to me like that. So the transformation or the connection with the deeper self, Devin talked about the ego death, or the ego dissolution, the activation, you said, of the default mode network. The ego, or the personality, is really what? For the most part, it's our concocted defense mechanisms that we identify with, and we think it's ourselves. So what happens when those defense mechanisms dissolve just for a moment? Then the truth of what happened to you and also the truth of who you are can emerge. So what I'm suggesting is that the healing doesn't happen because of some chemical effect on the cells of your body. It's not like a Western pharmaceutical. It happens because of the transformation of the experience of the self. Now, in the case of addiction, I will not make the case now. I made the case in the same room 4 weeks ago, that addiction is rooted in trauma. And let me give you a definition of addiction. Addiction is a complex psychological, physiological process that manifests in any behavior that a person craves, finds temporary pleasure or relief in, suffers negative consequences as a result of, but doesn't give up. So that's what addiction is. I said any behavior. I didn't say drugs. Any behavior. Craving, temporary pleasure and relief, long-term negative consequence, difficulty or inability to give it up, that's an addiction. All right? So let's do a survey here. According to that definition, how many of you would acknowledge that sometime or another you've had an addictive behavior in your life? Just raise your hand. Okay? I mean, hardly anybody who has not raised that. Okay, so let me just ask you this, and some of you just please tell me, just raise your hand and tell me. Not what was wrong with the addiction, but what was right about it. What did it do for you? What did you like about it? Yeah. Can you shout it out though?
It felt like a warm hug. It felt like a warm hug.
You felt love. You felt love. But that, by the way, you're far from the first person to tell me that. You know, it felt like a warm, so a sense of being held and love and connection, right? Okay. Who else? Yeah.
Like replenished.
Say it again.
Almost like you feel replenished.
Replenished,
Yeah.
like filled up again. Okay. So yeah. Escape from. From. But why would you want to escape from life? Because life is painful, right? I would say, so we could take many more, but it's always the same thing. So being loved, being held, being filled up so you don't feel empty, and escape from pain, or pain relief, are these not normal human aspirations? In other words, you just want to feel like a normal human being, that's all. The real question is, so first of all, the addiction is not your problem. The addiction is your attempt to solve a problem. And the real question is, why on earth, amid 7 billion human beings, did you not feel connected and loved and held? What made your life so painful that you had to escape from it? Why did you feel so empty inside that you needed that temporary replenishing? Well, these are life questions that are based on, in every case, childhood trauma. And so, even the medical model of addiction being a disease is only partly true. I mean, addiction behaves like a disease. It's got remission and relapse. It affects organs, the brain particularly, but other organs in the body as well. It causes damage, so on. So you can call it a disease, but that's a very narrow view of it. What it really is it arises as an answer to life problems that are posed by early experience. Now, under the impact of psychedelics, and any psychedelic actually, two things can happen. One is, like in the case of Mandy, who her father told her very specifically that she sexually abused her, but she couldn't recall it because the way she dealt with it as a child was to totally push that below the level of consciousness. And anything that we push below the level of consciousness is going to run our lives. That's just how it is. Carl Jung said something like, if we don't know what's in our unconscious, we'll just keep suffering and we'll call it fate. It's not fate. We're actually puppets over unconscious. And, or as the Swiss psychotherapist Alice Miller said, we're prisoners of childhood. So, under the impact of psychedelics, two things can occur that are beneficial. One is, you can actually get in touch with, if not direct memory, although often direct memories, but the emotional memory of what happened in childhood. So sometimes, under the effects of psychedelics, people have very painful, very alarming experiences, which is why the setting is so important. So they get in touch with very deep emotional pain, but they do so with the insight of an adult. So it's almost like they can accompany themselves back into childhood, consciously. And especially if they have support and guidance before and during and after. So people get in touch with some very, very deep pain that they spent all their lives escaping, and a lot of these behaviors, like Mandy's, of being nice to everybody and never being angry, these were just trying to escape from the pain of not being wanted and loved. Or the addict who tries to escape. Or the person who pushes down her feelings, and what do we call it? What's the word for pushing down? Depression. Depression is a response, it's a coping response to childhood trauma. People push down their feelings when they're alone with them and they can't bear them because they're too vulnerable and too small. Then we call these diseases. Well, that's fair enough. But they're not only diseases. And so what happens under the psychedelic experience, people can get in touch with what they've been trying to escape all their lives. But now they do so with the consciousness of an adult who's receiving support and who's actually safe. So they can actually have permission to go back to those places. That's the first thing that can happen. And the other thing that can happen ideally is that when they allow this dissolution, or at least loosening of the ego, they can experience who they really are. And when people experience who they really are, they get in touch with a lot of love and a lot of possibility and courage and all these things that they couldn't be when they were kids. So now you've experienced what you've been running from all your life, and you've also possibly experienced a person who doesn't have to run anymore. This is how they work. Now, this is an idealized, encapsulated, certainly abbreviated version of it. There are some people who have a psychedelic experience and it changes them, it changes them forever, you know, in a very positive way. I'm not one of these people. I've never come out of a psychedelic experience so transformed that I had no more problems, you know. I'm still waiting for that experience. Some people have had them, but most people don't. For most, it's the opening of doors, the gaining of awareness, the glimpsing and experiencing of possibilities, and then it's continued work and integration to have those new insights and possibilities illuminate your life. But it's a kind of opening that nothing in Western medical culture can possibly provide, and nothing in Western medical culture even thinks about providing. So they're very potent possibilities. I'll just say a word about a specific substance that Devin briefly talked about, ibogaine. Ibogaine is the one of psychedelic that has a very specific molecular action that's immediate and quite astonishing, which is that you can have an opiate addict who's done heroin for 20 years and would go through severe withdrawal if they quit. And for most of these people, for many of these people, the best we can do is to give them a replacement opiate like Suboxone or methadone, which are good things to do, but that's sort of the best we can do. But if they do Ibogaine under the right guidance, and it has to be done well because it's got potential toxicities, they actually have no withdrawal after the first night. Now why the heck isn't that being researched up to yin yang? Do you know why? There ain't no money in it. What pharmaceutical company wants to make a product that you use only twice? Or 3 or 4 times? Not to mention, in the States, it's one of these, what do you call them, level 1 or schedule 1 substances. In Canada, it's got some kind of a gray zone so that it's available here, but nobody can talk about it too loudly either. So that's a very specific, it's a substance that comes from Africa that has tremendous potential. Again, it's no panacea, and just because you've given up, even if it helps you give up your opiate, you're not out of the woods, because guess what? All the pain you've been trying to escape all your life, now you're going to feel it. Now you have to have help to deal with that and to respond to your pain in a non-addictive way. But to sum it up, and maybe summing up what Devin and I both are telling you, and before we take questions, there's tremendous potential here. And behind that potential, there is at least reasonable conjecture about why these modalities should work. Bill Wilson, the guy who founded AA, was in a severe depression 20 years after he founded AA. So the AA made him abstinent, but not exactly sober. And he used LSD. And he had a profound experience with it. And he said that this has a real potential to show people a way out, he said. Now AA never talks about LSD or psychedelic substances, because to them that's anathema, because you're still using mind-altering substances. But their own founder found relief with LSD. So there's tremendous potential here, and the studies are always encouraging. It's very interesting, of course, that they're doing all these studies on end-of-life anxiety. You know, it's just kind of an interesting ideology behind that, because it means like they're dying anyway, it doesn't matter. You know, we can experiment with them. What's the difference between end-of-life anxiety and other anxiety? There's no special anxiety that's end-of-life. People have anxiety. So I'm hoping that very soon these studies that are often done on palliative patients will actually be done on 20-year-olds with no disease, just anxiety. Now, it's labor intensive. When Devin will do the MDMA work in his phase 3 studies, it'll take you and your therapeutic partner 6-7 hours to work with one client. That's labor intensive. Ayahuasca is a bit different. We can do a ceremony with 25 people, and I can do a integrative circle with 25 people at a time quite well. Not much more than that. In fact, I'm going down Sunday for our next retreat. But it is labor intensive. It would take people being trained. It would take a dropping of a lot of prejudice, a lot of nonsense that both informs or disinforms medical attitudes and also policymakers' points of view. But clearly the dam has sprung open and the water's starting to leak out, fortunately, and we're getting more and more evidence and more experience. I'm quite sure that psychedelics will play a much larger role. Again, there are no panaceas, but I'm quite sure they'll play a much larger role in the healing of mental health problems, addictions, and I believe of disease in general. Thank you. Anyone come up?